We are talking about the niches within the niches of everything that we've got going on here at Moment of Truth Physical Therapy. So we specialize in pelvic floor, nobody knows what that is, and we specialize in myofascial release, nobody knows what that is. We're gonna get into it today, you guys. Myofascial release is the main hands-on technique that we use here, and I'm gonna tell you why. Your fascia is all of your body's connective tissue. It's literally connected head to toe. We're basically a giant walking system of organs, which are balloons, sacs, tubes, wires, hoses. So let me explain a little bit more. Your nerves, if you think of those as wires, your blood vessels as tubes, they all sit within the fascial system, and it has a lot to do with the fluidity in our body, with the flow and ease of which we move. Inflammation can cause some gunkiness and restriction. Obviously, any injury, surgery, trauma, or other significant event that's impacted our body can all affect the fascial system. And so it's really important that we address that. It's part of how we're more thorough. It's part of how we're not just looking at pelvic floor, but we're addressing what's going on with your neck. We work on the jaw sometimes. The jaw and our psoas and our pelvic floor, very, very, very connected. And so we're trained in that for the full body, and it's really critical to getting those lasting changes in the system. My other favorite thing about myofascial release is that because we're working with a lot of pelvic floor clients, a lot of pain and tenderness and often trauma associated with that area, whether it's painful sex, birth trauma, issues with fertility, really horrible, painful cycles. A lot of these issues for women go undiagnosed for years. They're not heard, they're not listened to, their issues and symptoms and concerns are not acknowledged. And so we're here to listen, and that myofascial work is very gentle, it's very slow. You're gonna see some other pictures where we do something called a cross-hand release, and it's a sinking into that fascial system in your body. It's sinking into that connective tissue and feeling those lines of tension, feeling where the body's able to let us in, feeling where it wants to shift and what the next easiest layer to get to is, so that again, we can create those lasting changes. Sometimes we might even hold a leg or an arm and lean back a little and feel lines of tension up into the body and help open up a hip or something that the body is telling us is another area where things are holding or tight or gripping for some reason. So a lot of times we love this approach because it's so gentle. It immediately puts the nervous system at ease, which is so critical, again, working on those sacred spaces that we don't want to create a nervous system response. We don't want to dig into that IT band where you're gripping and you're clenching and you're guarding. That has a time and a place, but not here, and not with myofascial work. And so we're really waiting for the body to let us in. We're really listening to those lines of tension and patterns so that we can get you more lasting results, more thorough addressing of the whole body, and creating a lot less inflammation and more ease throughout your entire system.